So a simple method to obtain autogenous bone occurs here with the auto chip maker. It can be done from the same surgical site in which we're doing our graft procedure or our implant, so we don't have to open up a second surgical site to obtain, bone. Different sizes. It comes with a little area that the spring attachment on top of different diameters, and we can rotate this at the site and obtain cancellous bone. Now, sometimes you might go to another exhibit or another meeting, and they're going to show you bone scrapers, where you can take some bone with a scraper, and you scrape that bone, and they're going to tell you, doctor, this is autogenous bone. But those bone scrapers only give us cortical bone. Cortical bone is the end stage of osteogenesis with osteocytes. It is not giving us any inductive procedures, and it doesn't give us the cells for producing bone. So although it's autogenous, it's not really osteogenic. If we can use the automatic chip maker to go in to that same site and take cancellous compartment, then we will now be able to graft from autogenous from the same patient at the same area of the surgical site from a simple procedure at the time of surgery, which is a good point of care. And then that is added to our graft. So if you're going to be doing this procedure, one thing you do not want to do is use saline. This has to be without saline, and you're going to rotate the drill, probably at about 50 or 80 RPM. If you're using saline when you're doing this procedure, you wash out the cells, and what you end up with a whitish type of cell mass, which is only conductive, but doesn't give us the osteogenic capability. So you do this procedure without saline, rotate at about 50 or 80 RPM. You're taking cancellous bone in multiple spots to replace over a defect, let that heal, and then you can go on to final completion. Now, this is an incision that I like to use if I'm not going to be placing a healing abutment at the same time, or even with implant. And that is almost like a tongue flap. So what happens in this incision, I make a vertical incision, and then at the mucogingival junction, make the second incision and bring this flap over the crestal bone. This maintains healthy blood supply to that surgical site. Suturing is very simple and easy, and you don't have tension on that surgical area. And you can expose now that crestal bone. You do your implants because you have perfect vision, as we're doing here, the implants through a very typical procedure. And we have a little bit of loss of bone on the buccal area, which we're going to graft. So with the automatic chip maker, I can come in and take my cancellous compartment, my cancellous bone, add that now to my graft site, my defect, decorticate some of the bone before I bring my flap over, because remember, we want to tap into that cancellous compartment because that's where our cells are coming from, and we can then graft the area. The beauty of this is that we can then use a very simple flap technique to make sure that we have closure of our wound without tension on the wound. We have autogenous bone at the graft site, and we can stabilize this either with a membrane or with the customized titanium implant membrane. So here is the incision line, which is very easy to close. We don't have any exposure at the crestal region where we're going to be placing our implant. So I like this procedure because it confines my implant and my graft in a particular formation where I'm getting bone and blood healing into that area. So everyone can do this. It's a very simple technique, and if we take a few moments to look at this, I hope. Now remember, when we're doing this, we are not going to use saline because we don't want to wash out the cells. So for smaller areas, like around an implant, or small areas of a lateral window sinus graft or crestal sinus, this is an excellent technique to use in conjunction with the graft material and with the graft and or with implants. And you can use this technique in multiple areas around that incision line. All you have to do is expose more of that mucoperiosteal flap, but you do not have to open up a second surgical site in order to obtain the amount of bone. So here we have a defect. Now, if we're going to be grafting around an area of failure of bone adjacent to an implant, we could use the eye brush or the R brush in order to clean the implant surface itself, irrigate and flush, debride the area, which is just very good surgical technique. But now, instead of opening up a second surgical site, we're going to use the automatic chip maker to take autogenous cancellous bone from the adjacent area. Now, the reason for using that little rubber area, the latex region, like a spring, is that it limits the depth that you're going to be doing with the drill. So you're not going to have the disadvantage of going into a vital structure, such as a neurovascular bundle, say in the mandible. Now, once you have this autogenous bone, we can augment the effectiveness of this by using concentrated growth factors or other stem cells from the peripheral blood to aid in the cellular capacity of this matrix. Because we know that when we use autogenous bone, almost immediately 80% of those cells die. And what is left are mostly the cytokines and the growth factors. Now, because we know that concept, it is important to understand the significance of cancellous bone. A lot of cancellous bone is where we're going to find the blood supply, the nutrients, and the cells. Now we're packing the autogenous bone, a loose compaction, around our defect. And one of the rules that we talked about was how do you stabilize the graft? Well, this is a customized titanium membrane that's going to be placed over the implant area, and it will cover the graft, stabilizing the graft so it doesn't have micro-movement. So during the breaks, in the refreshment breaks, you're going to visit the exhibits, and this is a technique that if you're doing grafting or implants, is something that you're going to want to use. You have to have in your armamentarium, in your instrument base, all of the supplies needed for any of the situations that arise during implant dentistry. And you'll find with Neobiotech almost everything that we need, we are going to be able to have. So this is now stabilized. And what is left now is to either cover this with a concentrated growth factor membrane and do proper suturing. Now, in order to try to get primary closure of this, we have to fillet the periosteum in order for that flap to be repositioned without tension on the wound. So the whole idea is to get primary closure or around the implant, but there has to be a very passive positioning of that mucoperiosteal flap when we suture. So we'll move on